Good morning. Today we are talking about adverse drug reactions. Okay. So, what is adverse drug reaction? You all know what is adverse drug reactions, right? Yes, someone tell. It is a harmful effect of drug which is unintended by the cause of drug. Okay. So, adverse drug reaction is any nauseous or unintended effect of a drug that is caused when used within the normal dosage limits. Okay. So, it is not when it is given more than the dose required. It does not happen like that. Only ADR is set to cause when the drug is given at the normal doses, but it causes unintended or nauseous effects. Okay. Okay. So, according to the onset of ADR, cause of ADR, while the duration of ADR course after we take the drug, it is classified as onset, severity, type and other classifications. So, when we look at the onset of event, we can say ADR is classified into acute ADR, subacute ADR and latent ADR. Acute ADR are said to cause within 60 minutes after taking the drug or within 60 minutes of administration of the drug. Okay. It is said to be subacute reaction if it is caused after 1 to 2 hours after the administration of the drug. Understood? So now it is said to be latent reaction if the reaction is happening it takes greater than 2 days to occur the event after administration of the drug. Okay. Now, based on severity of the event, it is classified as mild, moderate, severe and lethal event. An ADR is said to be mild if it does not interfere with the patient's life or it does not cause hospitalization or need any therapy or an antidote to reverse the damage caused. Okay. Then it is commonly known as side effect of the drug, mild side effect of the drug. Okay. And in moderate ADRs, it is said to cause a required change or necessity to not discontinue the drug but need an alternative treatment or treatment for the damage caused. Okay. That is said to be moderate ADR. And while discussing about severe ADR, which are classified as life-threatening and potentially causing severity or it needs discontinuation of the drug and specific treatment for the adverse drug reaction. Also, the drug needs to be discontinued or it will cause serious damages which are irreversible. Okay. When saying lethal ADRs, about lethal ADR, it contributes to the patient's death or causes death. It is directly proportional to the mortality of the patient. According to FDA, serious ADRs are classified as resulting in death and also life-threatening and which requires hospitalization and prolonged treatment. Also, some drugs cause disability. These all drugs are under the serious ADR according to the FDA. Also, some drugs cause congenital abnormalities. That is teratogenic drugs. Okay. And also which requires intervention to prevent the injury or treat the after effects. Types of ADR reactions. According to Wilson-Brown's classification, ADR is classified from type A to type U. That is, in type A, it is augmented type of ADR or augmented reactions in which reactions can be predicted. The ADR can be predicted from the pharmacology of the drug itself. We can predict the ADR from the pharmacology of the drug. Either it is related to the dose or related to the pharmacology of the drug. For example, anticoagulants. We are taking anticoagulants for what? What is the mechanism of anticoagulants? To stop the, break the clot. So, its mechanism is to prevent clotting. So, when used in excess or in excess doses in some patients, it will cause bleeding, excessive bleeding. So, that is what is related to the pharmacology of the drug. Okay, that is an example. And some beta blockers reduces heart rate. Okay, so while taking beta blockers, some patients experience bradycardia. Okay, bradycardia means low beats per minute. So some examples are given, and it requires skilled management to reduce their incidence. Also, the health professionals should know it is expected event. Okay, so while using these type of drugs which can cause ADRs, we should health professionals should know that this will occur, so it can be prevented.